Well, we're here with Dr. Melnick again, a dentist from Laurel, Maryland. Hi, Dr. Melnick. Long time no speak.
How you doing, Melnick?
Good. Dr. Melnick, let's talk today about a thing, implant. Let's talk about implant. But over the last, implant have been around for, 20, maybe 25 or 30 years, not so important. But over the last years, a few equipments in the X-ray area and in other areas have evolved, which not every dentist yet has, and yet makes the implant so much better, faster, precise, faster healing. Shed some light on that. Tell us a little bit about how that technology improved.
Well, I'll be happy to do that, but before I get started, let me just kind of correct a little something. Implants have actually been around for many, many years. Predictable implants, that's a different story.
Okay.
So I would say the turning point for the modern root form dental implants was probably about 1980 when they had a symposium in Toronto, Canada. The worldwide implantologists got together and basically established the foundation for modern implantology. And the technology keeps getting better and better. And just so that everyone understands what we're talking about titanium screws that are in the shape of tooth roots, and they provide the foundation to either attach a single tooth, a series of teeth, dentures, or, whatnot. And today, implants are well over 90% successful, so properly maintained implant restorations should be in your mouth your lifetime, and you'll meet your maker with them.
Compared to if you do a bridge where you have two teeth and you prep them, you basically grind them down, put a tooth over it. Those teeth, even though they hold very long and have served most of us or many people very, very well, they don't hold a lifetime. Is that would that be correct?
That's correct. There's two main advantages of doing implants as opposed to fixed bridge work. One you just alluded to. Fixed bridge work, like crowns, don't last a lifetime. They'll last many years, but they're in an environment that's unfavorable. So the margin between the edge of the bridge and the tooth over time is being hit with bacteria, and eventually that breaks down. Another advantage of doing implants is, let's say the two teeth on either side of a missing tooth are virgin teeth. They have no fillings. They have no cavities. Why would you want to remove healthy tooth structure in order to anchor a non-removable tooth when you can surgically place a tooth in the jawbone and have it anchored on a man-made titanium screw? And the surgery has gotten easier to do as technology has improved.
And I have heard, correct me how much I'm off here, that on an average, if you do one titanium tooth, which is the same material they use for hip replacement and stuff like that, you put one tooth in it, and as you said, you save the other teeth. So if the other two teeth cannot break down, but if you do the bridge, the other two teeth will now break down. It's almost like buying a copy machine, a fax machine, a phone, and a scanner all in one. Looks good, sounds good, but if one is broken, you have nothing. And I went through that not too long time ago, actually, in my home. But so at the same token, the price, one of those implants really isn't all that much more than 3 of the crowns, because you now need to put 3 ceramic crowns on it. Am I off there, or is that relatively correct, that the price is?
No, it's about the fees are roughly in the same ballpark. Another advantage of the fact that you're doing an implant is implants will maintain the bone, which is the implant fuses to, whereas if you start losing multiple teeth, the jawbone gets weaker because you don't have biting forces transmitted through the teeth into the bone. So it's like if you took a person who got sick, put them in a hospital bed, their muscles get weak. If you remove the teeth directly in the jawbone gets weak. And that's why people that have full dentures, over time, the dentures get loose. The dentures aren't changing. The person's mouth is changing. The bone's getting weaker and getting smaller. So by having the implant in there, it helps maintain bone support.
Right, so that they don't look like a dried out tomato kind of that old feeling. And also, when people have a bridge, which is basically melted together, or anyway, it's one thing. Apparently, it's more difficult to brush your teeth. And if you're somebody like me who is slightly on the lazy side in many things, I'm not as detail oriented as my wife, for instance. I might have a problem with brushing underneath, and by doing so, might create a little bit of gum disease, which otherwise is easier to prevent, and that, of course, in itself helps failing the bridge. Is correct?
Well, fixed bridge work does take a little bit more effort to clean around, especially in the area where the teeth are connected together. There are hygiene aids which will help getting underneath, but if you're not meticulous about doing it, it can, in some patients who have a high cavity profile, lead to higher incidences of recurrent decay and or gum disease.
And you definitely told us in another video how gum disease can affect the kidney, the liver, the heart, the brain, the diabetes, the immune system, premature born babies, name it. So that's not something we want to have. Let's talk to Melnick.
And some form, and if you don't mind my interjecting, and some forms of cancer.
And some form of
cancer. As we get more sophisticated with our medical research, we're finding a bigger and bigger connection between the mouth and body, and the linkage is bacteria in the mouth.
Very interesting. Yeah, I mean, the doctors keep finding out, with no doubt, more and more of that. For instance, surgeons, whether they do a hip operation or appendix, these days demand a clean bill of health for periodontal disease. They don't care about a filling here and there. They don't care about whether your teeth are crooked or not, but they want to make sure that you have no periodontal disease. Otherwise, their surgery is at risk, and the overall body is so weak that it might have complications during the surgery. And surgeons get more and more around that and demand that clean bill of health. Is that correct?
Absolutely.